Hi, this is Dr. Shivlila here. Today I am going to explain about the extraction instruments, that is extraction forceps. Actually, extraction forceps we have two types. They are American pattern and English pattern. In American pattern, the hinge is directed horizontal with the handles of the forceps, whereas in English pattern, the hinge is directed vertically to the handle of the forceps. Okay, now let's talk about the forceps that we are commonly using in the extraction during extraction. These are the instruments. Okay, first the instruments is mainly designed upon the on the base of the crown shape, root shape and the location of the mouth, that is either a maxillary or mandible. Depend on that the design is made, and then in the such a form that the forceps should have a nice grasp to the tooth and deliver the tooth from the socket without any slipping. Okay, and first of all, in the forceps we have a parts, that is two uh, two beaks, okay, one hinge and two handles, these two handles. Okay, in the handle we have a serrations, okay, so that it should have a nice grip, and it can rest on the palm of our hand. Okay, and the handle should be long enough so that for a steady and the strong movement during extraction. Okay, and then the handle, it might be a straight or a curve. Okay, let's talk about the beak. The beaks are commonly concave or a hollow, okay, and so that it can fit on the root surface. Okay, and inside the beak we have a serrations. Okay, we have a long serrations for better grip on the tooth, and usually the beak will be having a sharp edge so that it can cut the periodontal fibers. Commonly mandibular, the beaks are placed just below the CEJ, and in maxillary the beak is placed above the CEJ. Okay, let's talk about the holding the forceps. It's mainly depend on the position of the tooth. We hold the forceps in differently. Okay, commonly the forceps are picked and operated most commonly from the right hand. Okay, the thumb, usually while holding the forceps, the thumb is on the hinge or it can be below the hinge, and the handle, both the handles are rest on the palm, and while adjusting the hinge or while momenting the beak, the little finger, it lies inside the handle, in between these two handles. Okay, these are common, this is mainly common proper holding of the forceps. And for maxillary extraction, the beaks will be pointed towards the upper direction, and for mandible the beaks will be holding downward. Okay, it will be pointed downward for mandibular extraction. The basic movement of the maxillary anterior forceps is labial movement as well as mesial rotation. These rotation are given during extraction of the maxillary centrals laterals, okay, and even in the canine, and they are removed or pulled from the towards the labial direction. Okay, and now this is premolar forceps. Okay, this is premolar forceps. In the premolar, the beaks are both the concave. Okay, both are concave. Okay, you can see it clearly, and they are broad and open. Okay, so that the distance of the crown part, it can engage it properly. Okay, and the rotation for the first premolar, only the buccopalatal movements are given, not rotation. Okay, whereas in the second premolar we give a rotation with a buccopalatal movement, and it is removed by on the direction of the buccal direction. Okay, and now these are molar forceps. uh, this is molar forceps. Okay, the molar forceps, the beaks will be not similar, they will be not identical. Okay, one beak will be round or a concave. Okay, the other will be the pointed, like this pointed one. Okay, the pointed beak, usually this beak, that mainly engages the groove between the buccal roots, and the other beak, this engages the palatal surface. Okay, these two are placed just above the CEG. Okay, and okay, this way we have a one more one, there will be two. Okay, if the pointed, this is mainly for a these are mainly for a left the pointed beak, if it is placed or if it is viewed on the left side, then it will be the right sided operating forceps. Okay, and if it is on the right side, then it will be the left sided operating forceps, because the pointed beak usually engages on the buccal surface of the molar. Okay, one more set we have for molar forceps, those are cow horns. Okay, these are cow horns. Okay, even these are also an unidentical beaks, there will be no similar in the both the beaks. Okay, here one beak will be the pointed one, single point, whereas other will be the bifid pointed one, pointed tips. Okay, the single pointed tip, that mainly engages on the furcation between the buccal roots, whereas this mainly engages the palatal surface of the molar. Okay, and these are commonly known as a cow horn because they resembles the horns of the cow, so they are named as a cow horns. Okay, this is actually anterior root forceps. The similar will be having a posterior root forceps. Okay, these have a straight, slender, closed beaks. Okay, these are commonly used for extraction of the root stems of the maxillary tooth. And okay, this is maxillary third molar forceps. Okay, the handles are long, long, and the beaks are angulated shape when viewed from the side, mainly to hold the third molar forceps. And the extraction for the molars, usually we go for a ear shape direction. Okay, mainly to luxate the molar, and then the bucco-palatal movement, and then it is removed from the buccal direction. These are mandibular and forceps. Okay, this is mandibular anterior forceps, this is mandibular anterior forceps, and this is mandibular premolar, and this is for a molar. Okay, first the mandibular premolar, the beaks will be the identical broad and short and even a closed beak. Okay, these are the forceps. These are commonly used for an centrals and the laterals and even for the canine tooth. Okay, the movement of this forceps is mainly the labiolingual as well as the rotation movement, and the tooth is removed in the labial direction. Okay, now let's talk about the this is a premolar forceps. This mandibular is a mandibular premolar forceps. The beaks are both identical, okay, and they are open, broad, and they are more longer than the anterior forceps. Okay, these are commonly used for extraction of the premolar 1 and 2 premolar, both the premolars, and the movement is mainly the buccolingual movement as well as the mesodistal movement, and the tooth is removed in a labial or a buccal direction. Okay, this is mandibular molar forceps. Okay, this is mandibular forceps, molar forceps. Here the beaks are identical, broad, and there is a open beak with the pointed. They have a pointed tip. See, you can see clearly the sharp pointed tip that mainly engages the bifurcation on both the buccal and the lingual surface of the molar, first and second molar. Okay, and the movement is mainly the buccolingual movements as well as a little bit rotation. Okay, and is removed in the buccal direction. Very mild rotation is given here. Okay, this is a cow-horn, mandibular cow-horn forceps. Okay, here we can see both the beaks are identical, open, short, and they are pointed beaks. They resembles like a horns of the cows, hence they are known as a cow horn. Okay, the the tip that mainly lies between the bifurcation. Okay, bifurcation of the mesodistal root. It is placed over there. Okay, when pressure is applied, the beaks engages. It get engaged and closed. Okay, in the bifurcation that mainly helps to luxate the tooth. Okay, and sometimes it also squeeze the socket. Okay, and these are commonly used for extraction of the grossly decayed mandibular molars. Okay, sometimes the extensive caries of the crowns. The movement of the cow horn is same like a buccolingual direction. Okay, this is a mandibular root forceps. The forceps, the beaks of the forceps are identical, slender beaks. Here it is the closed one. Okay, the beaks are closed, and they are commonly used for a removal of the root stems in the mandibular teeth. Hence, these all are instruments commonly used for extraction of the tooth, maxillary mandibular teeth. Okay, hope it might help. If you like this video, please subscribe.